So trying to log into the Zoom school.
Please mute your microphones. Good evening, everybody. I'm just going to give everybody another 60 seconds, another minute or so, for everyone to be admitted into the meeting room. At this time, as we're preparing to start the meeting, I'll ask that everyone present, please mute your microphones because we're actually hearing quite a bit of background chatter at the moment. So I'm just asking everyone to please mute their microphones at this time. And we are going to start in about 1 minute. I'll repeat. Will everyone who have been let into the meeting room, including presenters, please mute your microphone so that nothing that you don't intend to go out goes out to the public. All right, I take this opportunity to say good evening and welcome to everyone on behalf of BARP. My name is Belle Holder. I'll be acting as your host and moderator for this session. It's a beautiful day in Barbados. Hope everybody had a safe and wonderful start to their work week. Today is Monday, August the 29th, and we are all here to be a part of this discussion with the Barbados Association of Retired Persons around the health plan and focusing also for those in the 40 plus, the newest members and the youngest members of BARP as well. I take this opportunity to say good evening and welcome to the president of BARP, Miss Marilyn Rice-Boo, and I'll hand over to you. Good evening.
Thank you very much, Belle, and a happy Monday to all. It is indeed a pleasure to welcome you to this first session. And as I said, this is session number 1 of the informative sessions. I would want to first acknowledge the presence of members of the board. You might not see them all, but they are here. And I want to acknowledge Dame Billy Miller, our Vice President, Orson Simpson, our Secretary, Monica Hines, Madam Treasurer. Want to also acknowledge Irene Sandiford Garner, Lennox Prescott, Eric Smith, Clorinda Allen, and Henry Barrow. We also have on this call members of our Oversight Committee. And the Oversight Committee is an Insurance Oversight Committee, and that is being led by Wismar Graves. Other members of that body, Honorable Lolita Applewhite and the Most Honorable Patrick Frost. Still BARP's team again, we value these sessions, so we have brought the entire BARP's team along. BARP staff, we have our interim CEO, Dr. Glenda Jilts, membership services manager, Cecilia Thompson, Sherilyn Mack, Judith Clark, or Belle Holder, our communications consultant, and Alexa Howell, who is also a member of our BARP's team. Before I share the welcome though, I would want to give our broker, Lynch Brokers, the opportunity to introduce their team as well.
Okay. Good evening, everyone. My name is Rosemary Austin, and I'm the director of the and Health Business Unit. And Deborah Comerbach, she is the account executive for the BARP plan. And last but CEO of Lynch Insurance Brokers and Associated Companies. Thank you for joining us.
Thank you very much, Rosemary. As I said earlier, that this evening marks the beginning of a series of meetings, and which we would term as meetings to share information. We recognize that there was a dearth of information with reference to the group health plan, and we are here to clarify those areas that you are concerned about. Today's discussion will be confined to the group health plan only, and the reason being the life benefit plan is still under active discussion. As a matter of fact, on Wednesday, there will be another meeting. So the life benefit plan, we are still in the process of negotiating that. So we will be able to share information on the life benefit plan post this meeting. On hand to address our concerns will be our brokers, Lynch Brokers, and the insurers, though present, they have opted for observer status. Our major objective of this meeting, on all of our meetings, is, I said, to address areas of concern. So at the end of the meeting, we are confident that you will be clearer on areas of concern prior to this meeting. If, of course, we haven't achieved our objective, then I would want you to feel free to contact our insurers. And who are our insurers? Sagicor Life, Trident Insurance, and Beacon. So you could feel free to contact them in the event that we have not clarified the area that you are concerned about. But I am positive that we are going to be able to clear up on any area of concern. At the end of this meeting, towards the end of this meeting, we'll also share some information relative to the 40 to 49-year-olds and with reference to open enrollment. But this meeting, the presentation will be delivered by Rosemary Austin. So you can feel free to make your notes at the end of the presentation. So just write your notes. Do not try to interrupt. At the end of Ms. Austin's presentation, we will have a Q&A. So you can ask us all your questions. That is where you would slot in your questions and areas of concern. We have addressed some of your areas of concern via our social media pages. We've also addressed them via our info at BARP. And of course, some of you came to BARP to seek clarity on other areas. So as I said earlier, and I can't say it enough, I want to welcome you all to this meeting. This is meeting number 1, because as time goes on, we're going to come back again with the broker and we'll walk you through how to file a claim, walk you through how to really use the plan. And that's important as well, so that you get the maximum benefit from your plan. So on behalf of the board of management, on behalf of the staff, and on behalf of the oversight committee, I welcome you all this evening to information meeting number 1. I now turn over back to MC Bell. Back to you, Bell.
All right. Thank you so much, Madam President, Marilyn Rice-Bowen. And I want to again take the opportunity to welcome everyone who's just joined us. As the President mentioned earlier, there will be an opportunity for some Q&A, but there will be a presentation given by Ms. Rosemary Austin of Lynch Brokers. And what you can also do, as Marilyn indicated, you can write down your questions. When we get to the Q&A section of today's session, you can put your questions in the chat and I can certainly pose those questions on your behalf, or you can certainly pose your question directly yourself by raising your hand, first of all, and once you're selected, you unmute your mic and you can cast your question directly. And of course, the tone of the meeting is informational and always respectful, as all BARP members always are. And that's exactly how we're expecting this evening's session to flow. So again, thank you all so much. And I take this opportunity to hand over directly to Ms. Rosemary Austin of Lynch Brokers. Ms. Austin?
Thank you, Belle. Okay, so we're going to start with a bit of information piece here, where we are going to talk about, let me just put it like this.
And actually, Rosemary, quickly, before you get started, I just want to let everyone know that there is a YouTube link in the event that you may be having any issues with your Zoom link this evening. You can actually click on the YouTube link that we have provided in the chat for everyone. You can click on the link and go on over and watch on Zoom and watch on YouTube as well. So we're here on Zoom. If you're having any issues and you prefer to view via our YouTube link, it is provided in the chat. I'm actually looking at it right now. It's provided in the chat. You can just click directly on the link and it will take you to the YouTube page. Thank you. Ms. Austin, the floor is yours.
Yes, yes, thank you. Okay, we're going to start with a bit of information as it relates to health insurance, and this would be the BARP health plan. Now, we know that health insurance is very important. One, because of the increasing significant part, it's a competitive benefit for most organizations, including the associations. And it is a benefit that is offered to the members. And right now, the members are from age 40 and up. The other thing is that it allows plan members access to life-saving medical treatment that they would not ordinarily be able to afford, or to which access may be restricted. The group plans allow for coverage for plan members who may not be able to secure individual coverage. So in other words, when the plan started, there were persons who probably, because of having a non-communicable disease, maybe who had issues prior to, and who would normally try to purchase an individual health policy, but would not be able to do so because of health issues. But because BARP had that open enrollment plan where everyone could join without providing medical evidence, they were able to access the health plan. Like I say, normally they wouldn't on an individual because they will be subject to underwriting. The other factor is that insurance is a key part of your financial security. And there are many people out there who do not normally seek insurance. If there's an issue with a family member or themselves, sometimes people have to raise funds, go to the GoFundMe page, keep activities in order to raise funds. However, with a medical plan, a group medical plan, you have the financial security there. And as I mentioned before, the cost of a group plan is less, it's comparable with an individual health. Normally, an individual health plan, you pay according to your age. However, because you're part of a larger group, that is taken into consideration, the size of the group and the average age of the group. So it is a benefit, a key benefit for having health insurance. I just wanted to make sure that we are very clear on that. Now,
all right, everyone, Rosemary seems to be having some technical difficulties. You may be able to see that her screen is frozen, and I'm trusting that if Rosemary can hear us, you're aware of it, and we can rectify that situation as soon as possible. Yeah, so you were frozen for a minute there, Rosemary, so if you care to recap what you said sort of like over the last minute or so.
okay. I was explaining the reason for having group health insurance. Can you hear that? Did you get that part?
Yes, please. We are hearing you and seeing you now.
Okay, pardon me. With the internet here, sometimes it's not very good. Okay, so then I wanted to go on to the performance of the plan. Let's look at the plan over the 4 years that it has been in existence. The first year, it was the premiums were $15,637,000, and the claims that were paid was $5 million. And I'll just just round it off, which means there was a loss ratio of 32%. It's claims divided by premiums. So in the first year, there was very good experience. The second year, 2019, 2020, it was $13,874,000, and the claims were close to $10 million. So that increased the loss ratio significantly by 70%. And the reason for that is because in the first year, there was a clause that said any pre-existing conditions will not be paid for in the first year. So after that, 2018, 2019, persons were submitting their claims. And that's why the loss ratio increased to 70%. In 2020, 2021, you had an increase in premium. The number of members who joined the plan, they were 14,122,000, and the claims were just under 10 million. And the loss ratio for that was 66%. And then there was last year's experience, 2021, 2022. $11,564,000, $564,000. And the claims, unfortunately, they were increased by 11,362,000, which resulted in a loss ratio of 98%. So you can see that there has been an increase in the utilization of the plan. But I would like to just state here that when you look at the premiums for 2021, 2022, it is not that the persons would have been, you had a drop in premiums. What happened was that there were persons on the plan, and pardon the dog keeping noise, sorry about that. There were, over the years, there were some persons who, for whatever reason, the insurance companies had taken them off, either because of non-payment of premium, and or persons who didn't know that they were on the plan, because lots of reconciliation needed to be done here. So the terminations, there were terminations from 2018, 2019, and 2020, but they were all done in 21, 22. So that's why you're seeing a reduced number here. But overall, the insurers has said that the loss ratio was 98%. So as a result of this experience, what they have done is that they have made some changes to the medical plan. And I want to say here that the changes do not affect the premium. There is no increase in premium for anyone in any of the categories. The changes are only for the benefits. So right now, effective August the 1st, the co-insurance, the medical
Okay, so once again, Ms. Austin of Lynch Brokers seems to be having an issue with her internet connection where she is located. And just asking everyone to be patient for Ms. Austin to come back to us, and we'll get her to recap the last minute or so of her presentation, as her screen appears to be frozen at the moment. So we're not hearing her. I'm hoping that you can hear me, Ms. Austin, so that we can rectify the situation and continue with this informational meeting. And I actually think that we have lost connection with her. I will ask Ms. Austin to come back into the meeting so that we can continue. And again, as people are showing up for this evening's meeting, at present, we have about 562 people present for today's meeting, which is looking at the BARP health plan. I know everyone has a lot of questions, of course, which will be addressed today. And we're waiting for Ms. Austin to come back into the meeting so she can continue her presentation. And of course, we ask that you note your questions so that they can be posed when we get to that section of the meeting. As I'd shared earlier, there's also a Zoom link. If you look in the chat, there is a that we can consider using the YouTube link. And we're just awaiting Ms. Austin. I actually have a recommendation here from one of our members who is suggesting that perhaps if Ms. Austin uses audio only, but the thing is she needs to do a share screen. So she needs to be able to show us her presentation.
Yeah.
And we're just awaiting her.
Okay, I am back.
All right, thank you.
Okay, I've changed location, so forgive me.
Wonderful. Wonderful. So yes, so if you could please just recap the last page or so, which people may have missed when your connection was frozen.
Okay. Okay, so what I was explaining was we talked about the performance of the plan for the last 4 years. And then I subsequently said that there will be no increase in premium based on the experience. What will be changed will be the benefits. And then I started to go through the benefits where you just and confirm, Bell, that you can see the screen.
Yes, please. We can see it and we can hear you very well.
Okay, great. Okay, The first change is the medical co-insurance. And I was explaining that co-insurance just means the sharing of the insurance. This is where the insurance company will reimburse 70% and you will be responsible for 30%. Okay, so that's just another word for the sharing of the insurance. Okay, the annual deductible, that has increased to $1,200. That annual deductible is the first $1,200 of eligible claims for which the insurance company will deduct, or which you will be responsible for before any benefits are paid. So unfortunately, if you have satisfied your deductible before, which was $750, you are still required to satisfy the additional amount for the calendar year effective August the 1st, sorry. So again, that deductible has increased to $1,200 effective August the 1st, and you're required to satisfy the difference from then. Now the surgical expense, that has been limited to $10,000 per annum, and the co-insurance has reduced to 65%. So that is only 65% is the only, the surgical is the only area which has been reduced to 65%. All other benefits will be paid at 70%. Hospital miscellaneous expense. This would be any expenses for drugs or anything with in the hospital that has been limited to $7,500 per annum. And the miscellaneous expense, which would be crutches or any supplies, that has been limited also to $75 per annum. The diagnostic expense, which would be any lab testing, that's limited to $1,500, and prescription drugs has now been limited to $900. The dental and vision, these have always also been changed. And the dental has been increased, the deductible, because there is a deductible for the medical, the dental, and the vision. So the dental deductible has increased to $100, and the co-insurance has reduced to 70%. Likewise, for the vision has increased the deductible to $100 and the co-insurance 70%. Now, let me state that for any cataract, the vision really is just the fitting of glasses or contact lenses. This has nothing to do with any surgeries and so on. So this is strictly for the fitting of your eyewear. And again, that's deductible $100 and the co-insurance at 70%. So those are the changes that have that the insurers have made to the plan as a result of the performance of the group. Taking into consideration the experience, which is what I showed you just now for the last 3 years, and because of the demographics of the group, which would be the age, the gender, and so on. So as a result of that, these changes have come about. Now, I just wanted to highlight a couple of areas that could help when it comes to your insurance. Now, you may, well, the plan has a calendar year maximum. And each time you submit your claim, it comes away from that maximum. So it means then that you have to manage your claims very, very carefully. And let me say here that health insurance is really for major illnesses. So you want to make sure that you have that peace of mind that if something happens, you have that coverage there. There are persons who definitely need to submit claims, especially for prescription drugs, for non-communicable diseases, but those can be the drug formulary will assist there. You can get those from there, and that kind of reduces your insurance. It reduces, or it doesn't allow you to continue to submit claims. Do not, if you are going to the drug formulary, we suggest that you get your drugs from there and not go to a regular pharmacy and submit your claims, because again, that affects the overall loss ratio. And most importantly, it affects the balance that you have left on your major medical maximum. Now, we do have your balances. It is not something that we will share publicly, but we would suggest that if you need to know, and if you need to know what your balance is, then that's something that's private, and you will need to communicate with us, and not necessarily just over the phone, because we don't know who we are speaking to, but we can let you know what your balance is, what's left for your major medical maximum. Now, the other area that I want to highlight is the preventative care area. And that's an area that is not heavily utilized, but we believe early detection is very, very important. And you are entitled to your annual physical and your mammogram and the prostate test annually. These areas, the preventative care is not subject to deductible. So if you're going for your test, you do not have to satisfy a deductible. You only need to make sure that the doctor notes on the claim form that it is an annual test. If it is that out of this annual test, he discovers that you have, let's say, a hypertension, and he just notes hypertension on the claim form, the insurance companies are going to assume that that's what you went to the doctor for, and it will be subject to the deductible. So you can have both diagnoses to stay on the form to say it's an annual physical and also the hypertension. But it is important to state it is an annual test. So I just wanted to let you know that that preventative care is there for you in the event for you to get your annual test done for early detection. I believe that is where we are at for now. The other thing I wanted to mention is that Belle would have alluded to that before. The 40 to 49, they will be coming on board effective September the 1st. Their benefits are slightly different, so we will have a session for them on their own. We didn't want to have it, included in this one. We are just focusing on what the changes that have been made effective August the 1st.
Right. And Ms. Austin, just kind of checking in with you to make sure the slides are changing out based on what you're discussing.
Yeah. The last slide was the dental and vision, but the housekeeping was for the preventative care and the drug formulary.
Okay, are you still in a share screen?
Yes, I am. Can you see the
so what I'm looking at right now is the medical changes. Is that what you have up?
No, I have the thank you up. You're not seeing the end? Sorry, I've had to move locations because of the internet. So right now, I'm at the end of the presentation, really, because the dental and vision was the last one. So what I spoke about, those were just extras.
Okay. Yeah, no, I'm not seeing the end page. Okay. And I've got a couple of messages regarding that.
Okay.
All right. So you're at the end of your presentation?
I am. Thank you.
Okay. Would you like to field questions at this moment?
Yes, I would.
Okay. So I've got a couple of questions already that are written. This individual says, with the $750 deductible, now it's $1,200, and each month they're paying $152.40. So it's a statement more so than a question. So if that individual would like to pose it as a question, then we can have Ms. Austin address that for you. And here's a question or comment. The challenge with an older person is that the probability of needing more than one mammogram or pap smear, if the lab results come back abnormal, is greater than a younger person, yet we can only claim for one test. Why is that?
Okay, you can only claim for one test under the preventative care. However, if your situation warrants the doctor requests that you have further testing, the medical plan comes into play. But it is one pap smear, one mammogram under the preventative, but any others would be subject to deductible, and then the reimbursement of 70% will be paid.
Okay. And Wayne Gooding, we're coming to you. I see you had your hand raised earlier. If you can unmute and pose your question. Wayne Gooding.
Right. Yes. Good evening. Thank you very much.
Good evening, sir.
My question is with reference to the age limits. I understand how the age parameters, let's say, especially at the bottom end. What is the lowest age that a member of the association can participate in this medical program?
Okay, so the medical plan, persons can join out from age 40. We are seeking confirmation that persons on age 40 to 49 without providing medical evidence. However, persons who are older will need to be subject to underwriting if you now want to join the plan. The maximum age to join is age 59. That's the maximum age you can join the medical plan. Have I answered your question, Mr. Gooding?
Okay. And here's another question that was written for you, Ms. Austin. The person says, good evening, I have a few questions. Rosemary stated that the health insurance is for major illness. So therefore, is there a major medical component and is there a critical illness component? Would you like me to repeat the question, Ms. Austin?
No, thanks.
Got it?
I understand.
Okay.
Yes,
All right.
I do. Okay, the major medical component. With this plan, it is one plan. It is a major medical plan. Years ago, you had separate plans with a basic and then a major medical. However, this plan is a major medical plan. So everything comes from, you have one major medical maximum and everything comes from that maximum. So there is no separating the small claims from any major medical claims. That's why it's important to manage the claims properly and for you to know what your balance is. As far as the critical illness is concerned, the critical illness is a rider that is it's a rider to the life plan, and it's usually 50% of the life benefit. So unfortunately, that is not a benefit that is added to this plan because I do believe the insurers terminate the coverage at age 65, I believe it is. So no, there is no critical illness added to, there's no critical illness on the BARP plan.
Okay, and I think they're looking for really a response from you regarding the deductible. So for over the last 5 years, this person says they've never got the $750 deductible and now it's $1,200. What is your response to that issue?
I do understand the challenges that persons will have as far as the deductible is concerned. We have been, I want to state here that we have been negotiating with the insurance companies from as far back as May when we got the renewal notice to more or less keep the deductible as is. However, that didn't work out. They insisted that the deductible has to be increased because the claims, they were seeing claims from both ends of the spectrum, the small claims as well as the large claims. So they felt that in order to try to stabilize the plan, to increase the deductible. However, we will monitor the plan on a quarterly basis to see how it is performing, to see if there's anything that can be done at the next renewal. At this point in time, there's nothing that we can do because so as not to for anyone to lose any medical coverage, we have had to continue sign off on the renewal to keep persons insured. So I do understand the challenge with the deductible, but unfortunately, that was the final decision to increase it.
Thank you. I do have a number of people who are asking about the pages of information regarding the dental and vision, which was not seen by the attendees because it's stuck on the medical changes, which is the last slide I would have seen as well. And so multiple people are asking if it's possible for you to still present the pages that focus around the medical and the
dental?
vision. And yes, please.
Okay.
If you can do that, and then we will take
Okay.
more
Can you see the
questions.
screen now?
So what we're seeing right now says the slide that says medical changes.
Okay. Let me just go back up. Here's the dental and vision.
Okay, wonderful. Thank you. Can you recap that for us?
Okay. The dental and the vision. The plan has 3 deductible areas. The plan is made up of 3 areas: the medical, the dental, and the vision. We just spoke about the medical deductible that has increased to $1,200. The dental deductible has increased to $100, and that coinsurance has reduced to 70%. Remember, the coinsurance is the sharing of insurance. And similar to the medical, that has now reduced to 70%. The same thing with the vision. The vision is $100 deductible. That has been increased. And the coinsurance has also reduced to 70%. And I just wanted to explain that the vision is only for the fitting of glasses and contact lenses. It doesn't affect persons who may have to have cataract surgery or anything, or even, let's say, someone went to the optician for conjunctivitis, commonly known as red eye. The diagnosis on that will not affect your vision because that's a medical issue. So even though it affects your eyes, there are some things that will not be considered on the vision, which will be the cataract surgery or any conjunctivitis. But as it relates to the schedule of benefits, anyone who requires this information, we can always, it is on our portal as well, Lynch portal, as well as BARP portal, and we can email this to you.
Okay, so we can go to the next question. And that question, Molly, we noticed that your hand has been raised. We can take your question. You can go ahead, please, and unmute so you can pose your question. Molly? So I've asked Molly to unmute. Go ahead. Thank you. Molly, go ahead with your question.
Okay,
comment,
can you hear
please.
me?
Yes, we can. Thank you.
Yeah, can you hear? Okay, great. I have a couple of questions. The first one, what accounted for the large increase in claims experience? I'm just wondering if it could have had anything to do with COVID. And also, when something like this happens, it's pretty much a one-off. And I think to drastically reduce the benefits because of something like that, rather than waiting to see if it is a sustained increase, to me, it just seems like a bit of a knee-jerk response by the insurance company. And whereas I'm glad that the premiums weren't increased, to have the benefits in a time where, you know, right now the cost of everything has increased, and what you say, you're not increasing the premiums, but what you're saying to members is, well, we're making you pay more for the medical expenses that you would likely incur at this time when things are so hard on a lot of people. So I'm just saying, it just seems a bit of, as I said, a knee-jerk response to something that might be, you know, just a one-off situation because of COVID. Why not wait and see how things go during this period? And then if it's sustained, then you have a reason to, you know, reduce the benefits. But to me right now, looking at it, it does not seem encouraging to anyone to want to join the plan because the benefits are really quite skimpy. for persons who only have BARP to rely on. So I just wanted to know what you would say accounted for the large 98% claims experience, and also what is considered to be a good claims experience.
Okay. As far as the claims experience is concerned, when I think, let me just go back here. Right. When we did an analysis, when we looked at the information that was provided by the insurance company, it showed that, surprisingly enough, the majority of the large claims were for cataract surgery. And I do believe that there has to be some arrangement, or some meeting of minds going in to talk about how best we can look to have the cataract surgeries probably reimbursed, maybe for a lower cost or so, given the number of cataract surgeries that we are seeing. But this 98%, I'm not sure if you were on the call, was as a result of the drop in the premium, and the drop in premium resulted from persons who were terminated. So it was a combination of the two, but the claims were not. It is possible that COVID persons who would have had their cataract surgery would have deferred these surgeries until maybe after COVID. And yes, we did approach the insurance companies and ask them to defer any increases. Let's wait for the plan to settle, maybe until January or so. So yes, we were in negotiations for some months. We had a number of meetings with them. So we did try to get that done, get any adjustments deferred, but they were concerned that there would be an increase based on the performance of the plan. It was deteriorating, and they wanted to put measures. They felt they needed to put measures in place at this point in time. So to answer your question, it is mostly the cataract surgeries, which were probably deferred for the last 2 years, that have impacted on the claims experience this year.
Okay, so in follow-up to that, if the claims experience improves over this current year, is it likely then to see that we will have an improvement in benefits over the next renewal period?
Oh, for sure, for sure. We will definitely be negotiating for better benefits if the experience, and which we hope will happen, especially with the onboarding of the younger persons, because what really determines the rate for a medical plan is the average age of the group and the experience. So having the younger persons, and that's why we're going to have to try to recruit as many young people as possible to come on board to reduce the average age of this plan. So yes, we will, as I mentioned earlier, we will be monitoring the plan on a quarterly basis to see what's happening, make sure that the numbers are, we just monitor it to see what's going on. And then at the end of the year, or before the end of the year, then we will be able to negotiate with the insurance companies for better benefits.
Okay, just for the general information, what is considered to be a good claims experience? Yeah.
Okay, for this size group, because that varies depending on the size of the group. For this size group, an acceptable loss ratio is 70 to 72%. So in 2019, 2020, and 2020 and 2021, yes, there were, you've had very good claims experience on the group. It is just 1 year.
All right, thank you, Molly. We're going to move on next to Jennifer Boyce, who has her hand raised. Jennifer, if you can please unmute so you can pose your question.
Yes, good evening.
Hi there.
Good evening.
My husband pays an insurance for me, and I'm also paying BARP. So you're telling me that the money that he's paying have no bearing on my benefits with the BARP insurance, because I'm saying now that maybe he could stop paying that insurance. No, if it don't have no bearing on my my benefit?
So just for clarity, he pays your insurance under another medical plan?
Yes, his work and is with, yes, with his work,
Okay.
yes.
Okay, that is what is called the coordination of benefits, where you can claim under both plans. You can claim under as a dependent and the primary person for the BARP plan. You can claim under the BARP plan first, and then you will submit your claims to your husband's plan, and you get up to at least 100% of the claim. So in other words, if you spend $100 at the doctor and the BARP plan pays $60, you can submit for the difference under your husband's plan as a dependent.
Oh, so I will have to submit both. I will have to submit. I will have to
Yes.
submit twice.
Yes.
Oh, that's
If
what I
it
will
is-
have to do.
Yes, if it is that his plan is covered under a Sagicor is the insured, you just need to make a note on the claim form. There's a claim form that asks you if there's another plan. If it
Yes,
is
yes.
not, right, well,
Yes.
you would note that on the claim form that you're
Yeah.
covered under another plan.
Yes, I do that. So what I was saying, so that means that I will still benefit from
Correct.
the insurance he's paying, because I was saying if it don't have no bearing on my benefit.
No,
that
you can
I
claim
will-
under both. What you can do is give us a call
Yeah.
tomorrow or so, call the office and we will go through that with you.
Yeah.
Oh,
Actually,
okay,
I'm really
thanks.
glad that you said that, Miss Austin, because I think in some cases here, obviously we have lots of people who are in the meeting. We want to get as many questions as possible. And so for more specific personalized queries on your insurance, then definitely you would benefit by contacting the office directly so you can have that. Next individual who had their hand raised for quite some time, and I think it was Esther. Esther Thornhill, if you can unmute and pose your question, please. Esther, are you there? Okay, I'm not seeing Esther anymore. So here is a question that was posed in the chat, and then we'll come back to those who have their hands raised. This individual says, the 40 to 49 members have been included in the health insurance. Can you ask when they will make a review to include persons in their 60s who are healthy, since 60 is now the new 40, and what relevance does that pose in terms of, despite the numbers and your chronological age, what your health and fitness age can be taken into consideration?
Yeah, unfortunately, the 60s, the age limit is was stated by the insurance company, let me say, and not BARP. And usually with the health plans, medical insurance, the maximum age of entry is usually 60. I know that was one of the areas we were thinking of approaching the insurers about, but it would increase the average age of the group if we do add that, let me say that. So it is not something that we are looking to do at this point in time.
All right, thank you. And Florette, if you can go ahead with your question or comment, if you can unmute, please.
Hello, good evening, everyone.
Hi, good evening.
Right. My question, I sort of get the opportunity to ask my question a little late because what Miss Austin just said kind of, answered what I want to, but I'll still express my concern. What I am particularly concerned about is the 59-year close off for being able to join the plan. And my reason for this is the gates were open for the 40 to 49-year-old, which mean that the quantity of people that will be applying for the health insurance is considerably more, I would assume. And I don't see why, because Ms. Austin said that they're not considering right now going any further than 59 years. Am I correct?
Yes, at this point in time, yes.
Yeah, but I mean, any consideration at some point in time will be given to any age above 59, because you have a whole set of people on this bar that join bar that would love to be on an insurance plan, a medical plan. And this is a group like between 60 to 65, that age group.
Yeah.
And I'm saying that BARP at least could agitate for that, set of people, because this is supposed to be a retirement plan, a plan for like all the people. Well, now the younger ones are involved, and kudos to them. But I mean, what's happening to the 60 to 65 age group, we feel as though the floodgates get shut right there on us. And we need some medical plan as well. We need an opportunity too.
Yeah. The good thing about it is that the insurance companies, as the president has said, the insurance companies are on the line and they are listening to the comments. And I believe they hear you. And we can look to include that in our good to have at the next renewal. At this point in time, unfortunately, there is nothing else that we can do to adjust anything on the plan. But I've made a note of it, and we definitely will discuss this.
Okay, well, my final thing to the powers that be is please kindly look at this group of people, because your numbers have gone up now by including the 40 to 49-year-old. Give us a chance. Some of us had insurance before, and because of circumstances had to give it up because managing loss of jobs and so on, and now people a little better place. Just consider that 60 to 65 age group. And that's my final thing.
Thank you, Florette. We're going to move
you.
on now to the next person, Barbara Lane, if you can go ahead and unmute. Barbara Lane.
Oh, good. That lady more or less asked some of the questions I was about to ask. Now, BARP is supposed to be for people, retired people. I don't see nobody retired at 59. No, those ages. And if they are going to be offering insurance, I figure it should be offered to persons over 50, over up to the age that people are allowed to be part of BARP. And I had BARP insurance I had insurance with BARP when they were with ICBL. But since I retired, I don't have it. I didn't have it. And when they were offering it free for all, as it were, at that time I had financial constraints, and I didn't go. But when I did go back to ask the question, I was told that I was too old to participate. But if you're this BARP, my contention is that BARP is for retired people, seniors, not 49s, not 49 and up, because those persons are now coming into the work market in the work world, and they who have left and made our contribution. I feel that we should be offered an opportunity then to take part, even if you didn't do it at first because of the circumstances. You should be allowed, even if you say, well, you are not going to be able to, you can't pay X amount of money anymore. Your premium has gone up because of this age bracket that you're now in. So I think that is what they should be thinking about, not cutting off the age at 59. 59 people don't begin to work. And therefore you should not be cut off because you have gone past the age of 65 or 67 as retirement age. So anyhow, I just want them to consider that, and people at BARP who is allowing this, because BARP is responsible for us. We have joined BARP, and then you offer this plan. I figured that BARP should have made a better come to some better agreement before the allow this decision to be made that up the cutoff point up to 59. That's my contention. I don't know what other people are thinking, but that's what I'm thinking. And
All right, thank you so much for your comments.
You're welcome there. Okay.
Thank you. All right, Mr. Proverb, Ian Proverbs, you have your hand raised. If you can please unmute and you can pose your question or comment, Mr. Proverbs.
Okay, thank you very much. Just in relation to what the lady was saying there just now, I have no problem with younger people joining because younger people will hopefully bring the loss ratio down. It's really interesting that the insurance company speaks to it as loss ratios when in actual fact they should be looking at their profits, which amounted to close to $19 million over the period of the plan. My question is specifically related to surgical claims. Now, as we age, a lot of us, our bones get more brittle, and we have issues with our knees, with our hips, etc. Am I right in assuming that if I have a hip replacement surgery, which may cost me between $25,000 and $30,000, that all that is being covered by the plan is $10,000? That's one. The second question I have is, why was the premium raised in the middle of the year? Is that associated with the anniversary date of the plan? And if it is, with all of those millions in profits, couldn't it have been the insurance company's position to give some goodwill to us as members and defer that until the start of the new year?
Rosemary?
Yeah, sorry about that. Your first question as it relates to the surgical limit. Yes, it is $10,000, and we really fought because we know there are very few surgeries that would cost $10,000, and it would be a disadvantage for persons. And again, the insurance companies are on the line, and they can hear the concerns and the comments from persons. And we hope that this can make a difference. But at this point in time, the renewal, I am not sure. I doubt very much that they're going to make any adjustments to the plan unless they increase the premium, but not at this point in time. At renewal, we expect that they would be better. We should be in a better negotiating position. As it relates to any increase in premium, no premiums have been increased. That's why the benefits were adjusted.
Deductibles though have been increased.
The benefits, okay.
Yeah.
Yes. Whereas there's no increase in premium, yes, there is more out of pocket for persons.
No, but what I'm asking is, why was there the increase in the deductible in the middle of the year? Is that associated with the anniversary date of the plan, or is that an arbitrary date by the insurance company in an attempt to make profit?
No, that is as it relates to the renewal period. The renewal is the 1st of May. So we are very late because we have been in negotiations with the insurance companies. So we did have some time extended, but the renewal period is the 1st of May.
Okay, so the single period blip where there is a 2% profit ratio outweighs the previous 4 periods where profits have been 30% or more. Am I correct in assuming that?
What I can say is that over the years, yes, the plan has performed well and there were profits. That much I can tell you.
So the insurance companies,
and that was our argument.
The insurance companies have a lack of a conscience, unfortunately, and we, the members of BARP, are suffering as a result of it, and that's unfortunate.
Again, it is good that the insurance companies are on the call and they can hear your comments and your concerns.
All right, thank you, Mr.
Proverbs. To hear from them.
Pardon me?
I say it would be interesting for them to say something.
Okay.
All right, thank you, Mr. Proverbs, for your question or comment. We'll go now to Joan Leacock, who has her hand raised. Ms. Leacock, if you can please unmute and go ahead with your question or comment.
Yes, good evening, everyone. I want to know what BARP is doing with regard to counseling, any type of counseling, especially bereavement counseling, because I think in this current trend, there seems to be a need for it. And if you are covering it, do you have recommendations? Do you have the amount of sessions you're allowed under your normal BARP coverage?
Okay. Under the psychiatric benefit, we have reached out to Sagicor regarding this, and we are waiting clarity, because usually the psychiatric is what is covered for any counseling sessions. So yes, this is something that we have approached the insurance companies, and we are looking to have that included.
So it's not included at present.
No, well, we are waiting for clarity on that.
And do you know how long that will be? The reason I'm asking, because the counseling services that are currently offered in Barbados are quite poor. And I would imagine that anybody who's a member of BARP at a certain age would need some help in this particular area for whatever reason, especially if you have to have a long-term partner who's died. They need to get over that hump, and in any other circumstances that somebody has died. So is this something that's never been addressed previously, or has it always been addressed and no insurance company willing to take it on board?
No, from my end, I can tell you that it was never addressed before. I've never seen, actually we've asked, we're waiting for confirmation as to why it was not included in the actual contract, because most policies do have the psychiatric, I call it psychiatric, but the counseling is included.
All right, can I come in here and state here that although it's not on the plan, from BARP's perspective, what we offer to our members free of cost, as a matter of fact, it will take effect from October. We are able to offer free counseling services for any of our members who are victims of elder abuse. There is in Barbados a bereavement support group, and that comes under the heading of the National Assistance Board, and they offer 24 hours service, and that's free support. And there is also the Alzheimer's Society there to offer free support. So whereas regrettably the plan does not have it there, there are organs in the island and in BARP in particular that recognize the importance of counseling, and those services are offered free of cost by professional counselors.
Thank you, Madam President. We'll take this question from Maria Mapp, who has her hand raised, and then I can post some other questions or comments from the chat, as long as there's a name along with that question or comment, so that we know who we're speaking to. Ms. Mapp, please unmute and go ahead.
Yes, good evening. I signed up to join BARP a couple months ago, around April, May. And when I inquired about joining the medical plan, I was told that it was coming up to the end and they would get back to us and so on. So now I'm hearing that once you are 50, you have to get, and you have to do underwriting and so on. So I'm wondering if that would apply to those who were trying to join from before they were 50, because then it means that we'll be sort of disadvantaged. So I'm just—
No, that would definitely not apply to those persons who were trying to sign up before. Definitely not.
Okay. So
because your name would already be in the system, so you will not be penalized as being late.
Okay, thank you.
Thank you so much. And Dolores Medford, you can unmute and go ahead with your question or comment, please.
Good night. I have a question relating to the group life.
group life aspect of the plan?
Ms. Medford, I don't know if you joined the plan late, but because we are still in the process of negotiating the life plan, we had said earlier that we will not be entertaining any questions on that because, as a matter of fact, there's a meeting scheduled for Wednesday. So there, we are still very much in negotiating the life benefit plan. So we don't want to open any discussion on that as at this point. We are prepared to open and answer any queries on the health plan.
Okay,
So,
thank you.
but yes, but we will come back with an information session too. And of course, at that time, we'll be able to take questions on the health and the life as well, because the life plan would have been concluded. But thank you very much for posing the question, but just hold it for us for a little while longer. Thanks.
All right, thank you so much. And now we have a question from Tony. If you could go ahead and unmute and pose your question or comment, please.
Yes, good evening. I just
Good evening.
heard Marlon say that you're not discussing the life plan at this moment. I understand what you said. But I just want to state here that my mom recently renewed her life plan this year.
Tony, if you could speak a little louder or turn up your volume, you're just really low on this end.
Okay. Okay. I just heard Marlon say yes,
Thank
that
you.
they're not discussing the life plan. But I just want to state here that my mom renewed her premium for her life plan a couple of months ago. So I'm a little concerned that they're now saying that they're in negotiations for the life plan. I understand you say you're going to discuss it later on, but this just comes over a little suspect to me that she's paid a premium. I know you're in discussions for the life plan.
Yes, ma'am. Yeah, you are correct. But those persons who would have paid would not be at a disadvantage. But as I said earlier, we don't want to entertain any questions right now on the life plan. But if you have paid already, you are indeed, your coverage is intact. That is all we are prepared to say at this point. But have no fear.
Thank you so much. And now we'll go to Keith King. If you can please unmute and go ahead.
Hi, good evening, everybody.
Hi there.
Good evening.
My question is, are the insurers using a 1-year experience by which to determine the premiums on the plan? If you look back over the 1, 2, 3 years, let's say, of this plan, the experience has not been bad, but it seems to me as though only in this particular year, when we are having this experience, that the rates are being increased. Shouldn't we be looking at it over a period of, let's say, 3 years maybe? And in negotiating, would you, in future, would you want to consider that? Not just take 1 year's experience, but take a couple of years experience in trying to make the assessment?
Yes, thanks for your question, Keith. Definitely 3 years. We always look at a 3-year claims experience. That gives you a trend and not just the 1 year. Overall, the last 4 years, our argument has been that the plan has performed well. There has been really no loss for the insurance company, but they are looking at the trend of the last year. They believe that they're seeing a trend where it could become progressively worse, but we do look at the 3-year analysis.
We know
And it
that's
does
a
show, yeah,
possibility.
yes, the plan has been performing. It has been acceptable.
I think it's unreasonable, to be honest with you. We know it is a possibility. It could trend in either direction. And unfortunately for the members, if the trend next year is better, I'm sure we're not going to see the benefit I should be seeing. Well, I shouldn't say I'm sure, but it is my belief that we're not going to see the benefit reversed in the way it ought to be.
What I can tell you, Keith, if I am still the broker on the plan, there definitely will be a fight to have the upgraded benefits. And again, the insurers are on the line and they are hearing you because they would know that there are other persons there are other members of the association who is very familiar with insurance. So I'm glad you raised that point. And yes, the 3-year claims experience is what is normally looked at. So hopefully we can get a comment from them.
All right, thank you, sir. And we only have a few minutes left. And so we're taking just final questions now. And Ms. Martin Gardner, we come to you. You have your hand raised. Please unmute and pose your question.
Hello, good evening, everyone.
Hi there.
I am one of the 50-year-olds that happened to be the last batch that qualified at 50 and was barred from enrollment because of negotiations. So now I'm subject to underwriting. My question is, I am employed and I am part of a group medical, but as a new BARP member, I intended to enroll anyway, because I am aware that by retirement, I will be too old to enroll. So I plan to run both simultaneously. So I'm already a member after retirement. The question is, if my current group is the same company providing for the BARP plan, am I still going to be required to do the underwriting qualification, given that they have all my records because I'm in another group under the same company?
Yes. Unfortunately, the groups, the insurers look at the group separate. So whereas you would be covered under another group, the BARP plan, you have to look at the requirements of the BARP plan, and they will request medical underwriting. The fact that they do have your records, that will be taken into consideration, but you will need to complete the initial information for them to assess you. That in addition to what the medical information they have on you.
All right, thank you. At this time, I'm going to hand over to BARP President Marilyn Rice-Bowen. Ms. Austin Rosemary, thank you so very much. And I really want to emphasize that for anyone who has questions about their specific insurance, I'm really emphasizing that you contact the insurance company tomorrow. That way there's actually time to be able to have your one-on-one questions answered that are specific to your insurance this time. So thanks again to Rosemary Austin of Lynch Brokers. Thank you so very much, both for your presentation and for answering the multiple queries that came your way this evening. I'm going to hand over now to BARP President, Ms. Marilyn Rice-Bowen.
Thank you very much, Belle, and thank you very much, Rosemary, for sharing the information this evening. We do recognize that there are a number of queries in the chat. For those persons who have placed a message in the chat with your name, you will receive a response. As I've stated earlier, this is information session 1, and we do intend to hold other sessions because we recognize that we need to assist our members with the use of the plan and the terms in the plan as well. So this is session number 1. With reference to BARP and BARP advocating for, I want to reiterate here that I happen to lead the team of volunteers, and we do, I don't like to use the word fight, but we advocate for matters related to your plan. It's not a matter of taking what is given to us. And we are also assisted by an insurance oversight committee. And this committee is being led by the king of insurance, Mr. Vincent Bargraves. So we do have a lot of qualified persons in our midst with reference to the insurance. And as I've stated earlier, we've heard your queries. I'm also aware that the insurers, they have been on the call this evening, and I do hope that they place a higher value on our members and that they would see it fit that the next session, which will be information session 2, that they come from behind the drapes and have that dialogue with our members, because we ought to keep our members informed. And we recognize that there were certain areas that of concern that our members had this evening. and that were outside of the remit of the broker and outside of the remit of BARP. So I'm certain that by information session number 2, we will have a richer panel and a panel with the insurers having that discussion with our members as well. There's a hand up. I think that's Gregory. If it is Gregory Rose from Lynch Brokers, we'll entertain it. If it's another Gregory, Mr. Gregory, we will have to pass. Let me verify, because if it's Gregory Rose, he might want to make an intervention. Is this Gregory Rose?
Yeah, hi, Madam Chair, it's me.
I recognize, therefore, members, Gregory Rose, CEO of Lynch Brokers, and I am of Gregory.
Yeah, I've obviously been listening very attentively. Everybody can hear me well? Shoot, I don't have the camera.
Yes, we can hear you.
I know you all don't want to see me at this stage, but anyhow, I'm not even sure if this is gonna work. But y'all can see me and hear me?
Very well.
All right. I would like to thank Rosemary in what has been it's a difficult circumstance, but obviously something that at the end of the day we've done our best to negotiate. The insurers have made some very important concessions. It's not an ideal situation. There are a lot of very good questions. And quite frankly, I would love to print off this entire chat. And I would like to respond one-on-one to everybody here. I have tried to respond to one or two, but it's been flowing like crazy. So I think we need a better forum. And quite frankly, I would love to answer every one of these questions that's here in this chat right now. But it's to find a better way and to look for long-term solutions. And obviously, we are here to work for you, BARP, and also every one of your members here. We're trying to find the best path forward. At the end of the day, we're looking for sustainability in this plan, but also affordable coverage and the best coverage that we can work with based on the demographics and everything that we are here to work with. And so, Madam Chair, I would like to obviously suggest that we have some upcoming forums. I mean, COVID has not been ideal. It's not been an ideal solution or situation for anybody. I would like to create some forums and stuff where a lot of these questions can be addressed and answered, either if we take these as a print off and respond in writing, or if we have some one-on-one focused groups. I don't know. I think there needs to be a path forward where we can address the concern of the membership and obviously work to find solutions that are beneficial to everybody. We're here to work together. This is a collaborative environment. We're working with BARP, where we've been in discussions all this week, all last week, and the week before. This is an ongoing process. The insurers are engaged. Everybody's engaged. We want to find solutions. And a lot of these questions can be answered. And I just want to put myself forward. I'm available to meet with anybody as necessary and go through anything that is pertinent. Rosemary and the team, we're all here to answer these questions. But there's a lot that needs to be answered. And I quite frankly don't think that. I think this is a start. It's not a finish. And I just want to let everybody know that I'm making ourselves open and available.
Okay, thank you very much, Gregory, for that intervention. Thank you. So Gregory, you just mentioned another area of meeting, and I'm thinking this, I don't want to put anybody on the spot, but this is a conversation among members, you know. I'm thinking maybe we can go to the gymnasium where we can, because the 3-foot space of social distance that has been removed. So maybe our next meeting, we can have the gymnasium, and you know, you can use the aisles, and we have a richer engagement there as well. And maybe after, you could have like breakout sessions, but we're here to present solutions. And we recognize that there are areas, that there are gray areas. Before we close, however, I would want to share with the members that as we look towards the future, because we need to make this plan sustainable and we need numbers to make it grow. And come tomorrow, as members, you are getting information before the press tomorrow. Tomorrow, we would launch on September 1st, we would launch an open enrollment period for the 40 to 49s. What is open enrollment? Those of you who would have joined BARP during 2018, you would have benefited from the open enrollment. Open enrollment during that period, you do not have to present any medical evidence. So the 40 to 49s, they will have from September 1st to October 31st to join the BARP health plan with the open enrollment come September 1st. So I want you to encourage your work colleagues and your friends to join, because we recognize today as well as before also that persons who waited to join the health plan, some persons wanted to wait until they retired. And when they retired, then they were not able to join the plan. So this is the opportunity. This is the opportunity for those 40 to 49s to join the plan, and that press announcement will be made tomorrow. And the more of the 40 to 49s we get, we will be assured that the strength of the plan and the sustainability of the plan, and it will strengthen our hand as well as members. I also want to share with you that we have saved, the whole chat has been saved, so nothing will be erased, so that every question will be answered. However, if you sent a question and you did not sign your name, well, regrettably, we can't answer those questions. I want again to thank you all for making BARP a priority this evening between the hours of 6 and 7:30. And we want you to stay in touch. You could write us at info@BARP. You can call us. You can go on our Facebook page. But we are going, those of you who posted your questions in the chat and or suggestions, we will definitely be responding to those by tomorrow's Tuesday, by Wednesday the latest. So Belle, you can go ahead and just wrap and thank you all. Thank you all again, and let's stay together. And I want to reassure all, we might not be out there shouting at the top of our voices, but we are always in the hallway working on your benefit, on your behalf.
Thank you, Madam President. That was the President of BARP, Ms. Marilyn Rice-Bowen. I take this opportunity to say thank you so much to Gregory Rose, the CEO of Lynch Brokers, and also to Rosemary Austin, the Director of Health and Life Benefits. Thank you so much for joining us this evening and fielding those questions. And of course, as Mr. Rose said, those questions will be answered, all of the questions in the chat. So anyone, while I'm talking, take the opportunity to drop a question in the chat right now and just write it quickly, because it will be recorded and the questions will be answered. I also take this opportunity to acknowledge and say thank you so much to the members of the BARP team who are working behind the scenes. Dr. Glenda Jills, CEO, Cecilia Thompson, the Manager of Member Services, also to Sherilyn Best, the Manager of Events and Member Services, Judith Clark, the Executive Assistant and Recording Secretary. We also want to say thank you so much to Caroline Scantleberry, who manages the website and the YouTube. Thank you all so much for being here. And most importantly, thank you so much to all of the members, all 520 of you who took the opportunity to sign on and attend today and have your questions answered. Remember, it doesn't stop here. This is a continuing conversation. It's not a one-off. We want to continue to connect with you and make sure that we are working to support you, our members of BARP, So remember, connect with us, info@barp.bb. There's also the website, barpbb.com, or you can call the PBX at Murphy House, which is the BARP headquarters on the South Coast in Marine Gardens, 538-2277. And again, all of the questions that were posed in the chat today have been recorded and your questions will be answered. Members, we hear you. We will also produce a number of FAQs, frequently asked questions, so that we can have those on the website as well for quick reference. My name is Belle Holder. On behalf of BARP, everybody, have a safe and wonderful evening, and we will continue to connect with you and work and advocate on your behalf. Good evening, everybody.
Good evening, everybody. Thank you very much.